Welcome to this episode of MedTech Matters. I'm your host, Ron Trahan. Post-op infection is often a devastating complication of cardiac surgery, making necessary a reoperation and a prolonged intensive care unit hospitalization that dramatically decreases a patient's quality of life. A sternal wound infection also raises the total cost of the cardiac surgery. Indeed, the additional cost for a single sternal wound infection is estimated to be in excess of $20,000. In this episode, we examine the impact of using the growth factors released from platelet-rich plasma, or PRP, to reduce the occurrence of infections in patients undergoing cardiac surgery. Cardiac surgeon Ed Woods, chief of cardiovascular surgery at Geisinger Medical Center in Danville, Pennsylvania, has been having dramatic success for the past several years using PRP as a standard component of his cardiac surgery protocol in patients for whom wound healing may be an issue.
I'm Dr. Ed Woods. I'm a staff cardiothoracic surgeon at the Geisinger Clinic in central Pennsylvania. Our discussion for today is sternal wound infections, which in cardiac surgery is one of the banes of our existence, and also one of the problems which remains unsolved and in fact has become more difficult as the obesity of our patients has increased. It is not uncommon for us to operate on people with body mass index in the range of 45 to 50. With up to 6 centimeters of fat between their skin and their sternum. This fat is very poorly vascularized, and therefore wound healing is retarded. In addition, as is well known, our patient population for cardiac surgery, in addition to having many more comorbidities of diabetes, etc., anemia, etc., also is aging. And so these patients are not only morbidly obese, but are also elderly. One of the last patients I did was 76 years old. She was a little over 5 feet tall, but not quite 5'1", and she weighed 216 pounds. So every organ and every structure in her body was equivalent to a person of that size, with the exception of her weight and the amount of fat that she carried around, which her ideal body weight would have been about 105 pounds. It's a big issue, and anything that we can do that reduces these infections and also aids in sternal wound healing and leads to a non-union of the sternum is worth doing. In our effort to improve wound healing and also to improve lower the infection rate, we've introduced platelet-rich plasma, which is from the patient, is autologous, into our treatment casket.